So, Dr. Blend, I have a million questions about GLP-1, but we'll try to condense it because there's social, psychological, physiological, metabolic. There's just so many things to talk about with this. But obviously, this is a huge category, and people are very interested in it. And there's a lot of pros and cons to it. Just overall, what's your take on it?
Yeah, thank you. So let's just go back quickly to the discovery of what has been in our bodies since time memoriam, which are called the intra-endocrine hormones, of which GLP-1 is a member of that family. And it's produced not by the glands out there in our body like are the sex steroid hormones or like insulin coming from the pancreas. It's produced by the gastrointestinal lining, the mucosa of the GI tract, that's directly related then to the interface with our food. So our food, historically, interfaced with the body's GI tract that had on the surface these receptors would pick up information from our diet and then stimulate that to release these hormones, intra-endocrine hormones, into the blood, like GLP-1, that would then stimulate insulin sensitivity, be anti-inflammatory, have all these positive benefits. Now, what's happened over the years is that we, with our diets, have stopped stimulating those natural receptors. They're called the L receptors on the gastrointestinal system. And so we haven't got the native production of the GLP-1s and the other GIPs and the other kinds of members of this family of the intra-endocrine hormones. And now we start to have dysfunctional information from our food. And the foods we're eating are not stimulating those particular types of things, the high fat, high sugar, high salt foods. So now we say, well, gee whiz, we can override this deficiency by giving a synthetic drug that stimulates that receptor site and keeps that thing going in activity that's 100 times higher than you'd have naturally. And by the way, it works. It will cause weight loss and it will cause beneficial effects on your blood parameters. But the question is, what happens if you overstimulate that 100 times above what is normal, and it continues week in and week out, month in and month out? Now, what are the results? We don't know the results. This is a whole new technology, a whole new pharmacology. It's overstimulating, producing super physiological levels of these hormones. And my experience with pharmacology is that over time what we learn is, it wasn't quite as successful as we thought it was for all people. So we don't want these people to be on these drugs forever. So what happens if you come off these drugs? Then you get this rebound effect. And now the body is starting to have an adverse effect. They gain the weight back quicker. They have a more difficult time re-losing it. And in the process, they've lost muscle mass because it doesn't just lose fat, it loses muscle. So all of this says to me, use the drugs sparingly if you use them for a short period of time and eat a diet that stimulates the natural release of these insulin-stimulating hormones, these intra-endocrine hormones.
Right, and we could really talk about the side effects, the social and psychological reasons not to perhaps do this, but the point is, what's attractive to people about this is that something can stop their cravings, and you're investigating some food choices that might possibly have that effect on GLP. Are there food sources that could act as GLP-1 agonists in the same way without those side effects?
Oh, that's a really fantastic question. So it turns out that these receptors that are stimulated that release that hormone, those hormones into the blood, are what are called bitter receptors.
Really?
Yes, they're bitter receptors.
What we would think of as
receptors in the tip of our tongue that pick up the sense of bitter, these are called the TAS2 receptors,
right,
are the same as you find in the gut. Our gut is tasting. It's tasting our food, and it's tasting certain bitter agents in our food that releases these GLP-1s. So think of what happens when we stop eating vegetables which have bittering agents in there, or whole grains, or some of the astringent types of natural foods, spices. Those are the things that actually stimulate the release of GLP-1. So can we construct a diet that would naturally activate the GLP-1 receptors? Absolutely. So we know, for instance, we've done studies and published many papers that hops, which is a bittering agent, stimulates it. We know that tartary buckwheat, which has a bittering component, stimulates GLP-1, releases it. So we know that bitter gourd stimulates GLP-1 release.
Do bitters that they put into drinks from the...
Yes, stimulates GLP-1. So the taste bitter, which we've kind of woven out of our food families because we like salt and sweet, are those that we need actually to stimulate natural GLP-1 release. So foods that have those bittering agents in them naturally are agonists or stimulants for GLP-1. So yes, you can construct the diet by looking at a complex natural foods, and that's why we're very interested in tartary buckwheat because it has just that balance of those agents that activate the GLP-1 release.
And when you got interested in that, it wasn't for that purpose.
No.
Because they found so many immuno-rejuvenating properties that it had and so many other things that were good for us. But this is a kind of a side effect.
Yeah, I
the
think that
buckwheat.
what we're learning is food in its complex whole form has all these wonderful symphonic orchestrated effects it can have on the body. And this 4,000-year-old food, tartary buckwheat, has these remarkable immune and body metabolism effects. So it's affecting both the metabolism and the immune system, and they're speaking to one another.
One quick question before we stop on that. Is that all buckwheat or is it just Himalayan tartary?
Well, it would be all buckwheat, but the tartary buckwheat has, because of the very high levels of these bittering polyphenols, has a higher physiological influence.